Well, hello everyone, and welcome to the Tenpenny Files. I'm your host, Dr. Sherri Tenpenny. The Tenpenny Files has daily conversations meant to inform and educate, not just to entertain. I come prepared, and we let the conversation unfold naturally with people worth hearing and topics worth exploring. It's a matter of your, it's a if it matters to your body, your freedom, or your future, we talk about it here. Each day, I talk with authors, documentary filmmakers, and independent thinkers whose work challenges mainstream messaging. We cover a wide range of topics, from government, politics, and history, to astronomy, pets, and travel, to food, farming, and fitness, to vaccines, health, and health policy. We also have a weekly conversation with authors or pastors who write about faith and biblical principles. My goal is to introduce you to topics you've never heard of before and topics that you always wish you had time to explore, but you didn't know where to start. My plan is for our guests to show you where to go for more information and for deeper study. Join me daily here, Monday through Friday at 3 p.m. Eastern Time at the Tenpenny Files, where we hear from voices that have often been ignored, silenced, or censored, but truly have something important to say. Before we begin today's episode, I want to invite all of you to come and join us to become a Tenpenny Prime member. Prime members receive a monthly exclusive white paper about your body, a recorded presentation, and access to a monthly Ask the Expert masterclass. And every month, we've been doing this now for over a year, and every month these master classes just get better. It gives you an opportunity to get your questions answered with one-on-one experts that I bring in really specially just for our Prime membership. To learn more, go to primemembership.drtenpenny.com and to learn more and to join and support our work. Now, let's get started. Today's conversation is with a pioneering figure in the field of animal chiropractic. Dr. Bill Ostrom, who's known and loved by all of us as Dr. O. Dr. O is internationally known for his expertise, advocacy, and commitment to improving the lives of animals through natural, hands-on care. We're going to be talking about his book, Yes, It's Really a Thing, Chiropractic for All Animals. Dr. O, thank you for getting up early this morning and joining us here on the Tenpenny Files. It's so good to see you again.
Well, you too. It's always a pleasure to see your smiling face.
Well, thank you. I grew up in a chiropractic family, and I'm an osteopathic physician, which does osteopathic manipulation in my office, and I've loved it. I'm one of about 400 physicians nationwide that are actually board certified in osteopathic manual medicine. There're just not a lot of us. So I'm in love with the idea of animal chiropractic. What brought you to deciding that this was a great thing and what you've dedicated your life to?
Um, well, I had the honor of being the father of an autistic son, and with a seizure disorder. Ironically, he had his first seizure 9 hours after his third MMR. Uh, but I was in vet school at the time, and so therefore it could not be a vaccine infection. Um, and and that was back in 1985, so there was no such thing as a vaccine reaction back then, right? Anyway, so when you have a handicapped member in your family, and it doesn't seem to matter what the handicap is, as your community finds out about the handicap, they have answers and they will help you find these answers. You should try this. You should do this. You should do this. When Aunt Edna had that, she did this. And as a scientifically trained mind, I was like, okay, but let's figure out what's going on. And so I would do some research. My first alternative degree was I have a doctor of veterinary homeopathy because I would buy a book on homeopathy and I would read it. And it would be like, for bruising, you take arnica, and you just go through the book and you get to the chapter on seizures. And it would be, seizures are a serious condition. You should contact a naturopath in your area. And I was like, okay, that's not really what I wanted to know. But, and so I found, and I have a degree in It's called a Doctor of Veterinary Homeopathy from the British Institute of London in animal homeopathy, veterinary homeopathy. And so started trying some homeopathics and then went to a 2-hour lecture um, on animal chiropractic. And I thought, well, that might have some benefits. Thought of a couple patients in my practice that it would help. And so I started doing more and more. And that's how I got into it. And then it was easy to stay into animal chiropractic once you get started because the results are amazing.
They really are amazing. And your book, I just love the book, and I just love the title of your book. Yes, yes, it's really a thing, animal chiropractic for animals, because you have so many great anecdotal stories in here of animals that they were going to put down, whether they were dogs, cats, horses, and or hadn't walked for a very long period of time. Or because they were getting older, they said, well, they're just getting older. We might as well just, euthanize them. And they came to you and you adjusted them and adjusted their atlas and changed their diets. And they got another 5 to 7 years of life. And with the horses, even longer. Because you've seen such great results and you are a licensed veterinarian. With your regular patients that you see, has this led you to be kind of an anti-veterinary medicine doctor?
There's a place for veterinary medicine, yes, but yes. So, and and it's hard to understand where that's coming from, but um, I, one of my other sons, I have 3 boys and a daughter, and chiropractic has really hit home to those, and it's helped me really understand how much impact I have on the animals that I'm in touch with on a daily basis, and not only the animals but other people
And their families.
and their families. When he was at the hospital, the one doctor said, "Well, he's got a 1% chance of life, and so we probably should just think about organ donation." Which
And that was after a severe accident, right?
car accident, yeah,
Mm.
yeah,
Yeah,
and we against medical authorization or advice, we transferred him to a different hospital, and he had a surgery that saved his life within 2 hours after being wheeled into the hospital. He was actually being wheeled out of surgery, um, the second one. And we asked that surgeon what his odds are. And he looked at us and said, "You don't care." Yeah, it's like, well, wait a minute, what do you mean? He said, "Well, in order to have odds, so let's look at Tegan. All right.
Tegan, for the audience, is my dog.
Yeah.
Yeah,
Yeah. Let's think about Tegan. And if I was going to do something to Tegan, you don't really care what the odds are. Because in order to get odds, we need 100 dogs that are in the same exact condition as Tegan.
exactly.
And then you have to look me in the eye and say, I care just as much for all 100 animals as I do for Tegan. Could you do that?
Of course not.
So do you care what the odds are?
No.
Or or would you rather that I do everything in my power to make sure that Tegan gets better?
Exactly.
And I think sometimes traditional medicine, looks at the odds. Um, the number one medical procedure in veterinary medicine right now for animals that may have a nerve injury, um, the first side effect of that particular remedy is gabapentin, but the first side effect is drunken behavior. And so if you have a dog that's having trouble walking, let's put him on gabapentin, and maybe he gets better, but a certain percentage of those animals will get worse. And so, you know, oh, just leave him on it a few more days. Let's see if it gets better or not. No, it's like,
When Tegan he did something to his back. I don't know. He's kind of for the audience, he's a Japanese chin, so that means he's short and kind of long. Not as short as a dachshund, but he's kind of short and kind of long. So he's kind of lanky. And Japanese chins have this thing. It's part of their breed where they spin around all the time. They get excited and they spin. They call it the chin spin. And so
right,
he's getting a little bit older, so he kind of threw his back out and he was in a lot of pain. I mean, a lot that he just laid there and just quivered. And he's a pretty tough little dog. So I had taken him to an emergency, a dog emergency department. And they said, well, it has to do with his back. And they wanted to prescribe four medications, one, a steroid, gabapentin, something to make his bowels move, and something else. And I said, I'll take the pain pill, but I don't want the rest of them. And so I give him, I've got that up in the cupboard like you would have in a leave up in the cupboard for you. That once in a while, when he's got something that I can tell, I'll give him a half of one, and that just settles him down. So instead, what I did was I got home, $1,000 later and a whole day out of my life to tell me that my dog had a back problem that I knew before I even went there. I called Dr. Bill. And I called Dr. Amy, who's his wife, who we've had on the show here before. And they said he needs to be adjusted. So they found me an animal chiropractor that's about 40 minutes from my house. And he went over there, he got an adjustment, and you could see the look on his face was like, wow, wow. And the next day he was just fine. And I had another episode, and I just do it telling you guys this who are listening to this about the wonders of animal chiropractic. There was another day that he had been staying with a friend of mine while I was traveling, and when I picked him up, he wouldn't put any weight on his paw. He wouldn't even limp on it or anything. He just would stand there and not put any weight on it. I looked it up online and they said it's an acute veterinary emergency. If your dog can't stand on its front legs where it puts 60% of its weight, you must take him immediately to the vet. And I'm like, I don't have another $1,000 and another day out of my life to go sit over there. So what did I do? I called Dr. Amy. And where is she? She's in an airport somewhere. And she walked me through how to do a animal chiropractic adjustment on Tegan. And like within he was kind of in a lot of pain, so he slept for a couple of hours. When he woke up, he was just fine. So this is really a thing. It's just so cool.
yeah,
And in your book, your book, yes, it's really a thing, chiropractic for all animals. I want to read this quote and then have you talk about it here.
okay,
It says, animal chiropractors don't fix or heal animals. Each animal is already whole, has an intelligence to care for itself. The proper, specific adjustment allows that intelligence to express itself as optimally as possible. And I think that's a profound statement. And I think that's your whole philosophy, isn't it, Dr. O?
well, it is because when we think about it, um, every animal, every being on this world comes with everything they need to survive. And that happens. We become equipped with that as soon as two cells got together in the womb. Because otherwise, how come Tegan's not a horse?
For sure.
Right? It's not because you fed him differently. It's not because he got a vaccine. At 6 weeks, he immediately when those two cells got together, he was going to be Tegan. No ifs, ands, or buts about it. Okay. Um, and I was going to be me, and you were going to be you, and the innate intelligence to keep our body working as it was meant to be was formed when those two cells happened. And then we get interference in our body, and our nerves can't communicate correctly. We have a foot that goes numb. We, have an organ that goes numb. Um, whatever. But we can't feel that organ that goes numb. But we sure can feel that foot that goes numb. And if your foot, like if you sit in a chair that's not appropriate, you will have a leg go to sleep. And when you stand up, you know it. And you're like, oh. And, most of the time you're able to walk that leg off. But the reason that leg went to sleep is because of interference to the nerve flow. Now, if we have interference to the nerve flow to my kidney, I don't feel that my kidney went to sleep, do I? I don't feel that my kidney's a little bit sleepy. And so what happens is then I go get a blood test somewhere and they say, oh my gosh, your kidneys aren't working. Here's some drugs. Right. And I had a professor one time at animal chiropractic school that said that children with ear infections aren't born with amoxicillin deficiencies.
Absolutely. Yep.
And so we have a tendency to treat deficiencies like Tegan hurt his back. He didn't have 4 drug deficiencies.
Right. Exactly.
He had a sore back. All right. So why did that back all of a sudden get sore? And at the time that his back got sore, the movement of that spine and what we call a subluxation, the formation of that subluxation was exactly the thing his body needed to keep him from getting hurt worse.
Mm, that makes sense. Yeah.
And so, because the innate doesn't never makes mistakes, it knows exactly what it's supposed to do. All right. And so the correct thing for that body to do at that time was to move that spine into an incorrect position to save it from further damage at that time.
Wow.
So Tegan didn't break his back, he got a subluxation. He didn't break his leg, he got a subluxation. Now, when that subluxation sticks around for too long, we know that within 4 minutes, the weight of a feather decreases nerve transmission by up to 40%.
Wow.
That was proven at Colorado State. Right. And he says there's a guy there that says the subluxation definitely happens within 4 minutes. They did a rabbit study one time where we know that within 7 days, you start to get cartilage damage. If the cartilage isn't moving correctly, that sticks around for 7 months.
Wow.
And so if you have a vertebral subluxation that's not moving correctly, the cartilage isn't moving correctly, the nerves have weight on them, because there's 5 things that show up in the cardinal signs of inflammation. There's swelling, heat, loss of function, redness, and pain. When we take drugs, 4 of them go away. It still leaves loss of function. When you go to the chiropractor, loss of function goes away and the other 4 go away too.
Very good.
Um,
You told me a story when we were together that has just stuck with me, and I've repeated so many times, and I probably haven't told the story correctly. But you told me a story about adjusting newborn baby chicks and that you did a study about that. Tell that story and how you came to adjust baby chickens.
well, we just feel that every spine should be adjusted. And so we adjusted our baby chicks. We get them at a day old and just doing it. And the study was accidental. Um, so buy my feed from Tractor Supply. Tractor Supply sells chicks from the same company that I buy my chicks from, but they sell them. And so we had chicks for about 3 weeks, and Tractor Supply at that time didn't have chicks for a long time. I think they were just kind of getting into it. And they had these chicks and they were tired of taking care of them. And so they said, Dr. O, why don't you buy our chicks from us? Buy the rest of our chicks. And I was like, oh, how old are they? They said, oh, they're 3 weeks. I said, well, you probably fed them bad food. No, we feed them the same organic food you do. Okay, fine. So I said, well, I'm not going to pay what you want for. I'll give you, less. And she said, okay, fine, but you have to take them all. And I was like, okay, fine. So I took them all and I go home and Dr. Amy doesn't know about it yet. And so I adjusted the new Tractor Supply chicks and put them in the pen with our chicks. And they're a different size. And so I'm like, okay, that's odd. They must have messed up the birthday. So the next week I go back to buy some more food and she goes, nope. She gets the book out, looks, nope, they were born the day I told you to. And oh, by the way, there's about 25 more checks that were in the other room that you didn't take. Do you want those? Well, not really, but and then we got down to where it was almost ridiculous not to take them. So I took those chicks home and adjusted those and put them in. And I now have chickens that are 3 different sizes that were all born on the same day.
Wow.
And so I told Dr. Amy, and she looked and she said, yeah, you're right, but we don't need that many chickens. So anyway, we told that story to people and they were like, well, there's too many variables. There's too many variables in that study. The chickens that came to your place on day 1 were in your brooder and your environment, and the other chickens were at Tractor Supply, and the third chickens were at Tractor Supply for a week longer. So we decided to do a study, and we actually bought extra chickens, and we had a high school student that was going to be our non-biased weigher. And he didn't know anything about chickens. He didn't know anything about chiropractically adjusted chickens. He'd had some sheep that we had adjusted, and they did well in the show ring, but he was just going to weigh chickens. And so I would adjust chickens 1 week, and he would weigh chickens the next week. And as the study was going, like after about the 3rd time he weighed these chickens, he would like pick up a chicken and he would say, oh, this chicken's chiropractically adjusted. And he would write the weight down. And I was like, well, how do you know? And he said, well, the adjusted chickens have more muscle tone. They're firmer and they're gaining weight faster. And in our controlled study, we like to process our chickens at 6.5 pounds. And our adjusted chickens were processed at 92 days, and our non-adjusted chickens were processed at 114 days.
Wow.
So
That's a big difference for if you actually were a chicken farmer.
right. It allowed us to put another batch of chickens through our facility every year. Because we could get four groups of chickens through rather than just 3. And so
when you did that study, when you had the adjusted chickens versus the non-adjusted chickens, how many chickens were in each group?
50.
50?
Yeah.
Oh, wow. That's a good size study. That's not.
Yeah, but it was too, when most of these chicken barns that we're looking at where our chickens come from are like 1,000 to 10,000 birds. And we know we can reproduce it on a larger level. It's just getting the funding and the, in the right places to do it.
Certainly makes a huge difference, though. And I think that,
Yeah.
when I visited you and Dr. Amy, you told me now that there's 2 restaurants that are in the Dallas area that are requesting chiropractically adjusted meat.
Well, yes, they're looking at it. Yes, it's not there yet, but it's looking at it. Yes.
Wow,
Yeah.
that's really cool. Well, I'll tell you, the when I came to your house and we had beef for lunch, it was like melt in your mouth delicious. It was really so good. So because of that, it makes so much sense when you tell that story about the baby chickens because how do they get out of the shell? They're bang, bang, bang in their beak against the egg, and that the shells of organically raised chickens tend to be thicker and a little bit harder.
right.
You really have to bang their necks. And so it makes a lot of sense that they've jammed up their atlas. And if you just adjust that, it just makes a whole lot of sense. Why wouldn't everybody do that? It's just common sense to me.
Well, and one of the things that I talk about, we know that birth is a very traumatic experience for all species. It doesn't matter, because we go from a passive environment to a very active, hostile environment, in a matter of, well, some women would say, it takes way too long. But usually the from my point as a veterinarian, it's that has to happen in 4 minutes or less, because when we start the birthing process, at some point in time, the placenta gets shut off, the umbilical cord gets pinched, and you either have 4 minutes or so like when there's a birth trauma going on, if that cord is compromised, you have 4 minutes. If the cord is not compromised, it's the baby can stay there for a long time. All right.
I had a friend that just had a dog that just had a 13 puppies.
Wow.
And 11 of them came out and were just fine. And then the last two were born dead. One came out 30 minutes later, and one came out like an hour later. And that poor
Yeah.
mama was so desperate. She just was desperate about those dead puppies and just, licked them so desperately and really
Yeah.
tried to bring them back to life. And it's probably what you said, probably a compromise about how long it was taking, just because there were so many puppies.
Well, yeah, and usually what we find with those is that um, the most common cause of fatigue is so probably low calcium in birth, but also a chiropractic subluxation,
Wow.
because the body can't. And there's three things that cause chiropractic subluxations: thoughts, trauma, toxins. So was the mother during that lengthy birthing process of delivering 13 babies, was she having any adverse thoughts, trauma, or toxins
Probably.
causing vertebral subluxations, leading to early fatigue and difficulty getting those last babies out? So, like our dog breeders, they take temperatures, so they know that the babies are going to be coming within the next 24 hours because the temperature will drop. And then they check the pelvis, and we teach them all how to check the pelvis and make sure the pelvis is symmetrical, so it has the most optimal, biggest hole possible. Because if my hand is like this, I have a big hole. And if I just get a little bit off, that hole gets smaller. It's the same size, but it's functionally smaller. And so we get calls at 9:30 at night. Hey, one of my dogs, temperature just dropped, and her pelvis is out of alignment. Can I bring her in right now?
Wow. Well, Bill, hold that thought right there. We need to
Okay.
take a quick break from our sponsors. This is so interesting. I wish we could go on for hours and hours because I love animals and I love talking about it. In fact, when I was a kid, I grew up on a farm, and it was one of there's only two other things that I wanted to be besides a doctor, and one of them was a veterinarian. So I love talking about these stories. This is great. So
All
we got
right.
a great sponsor that's coming up for us right now. You can listen to the Tenpenny Files on the iHeartRadio network and Monday through Friday at 3 p.m. Eastern. And if you missed any of these great conversations, you can find them on Spotify, Pandora, Apple, TuneIn, iHeart Virtual Studios, and my platforms at drtenpenny.com and drtenpenny.substack.com. We also play them on Rumble, X, and Instagram. There's so many great books, so many great conversations, and so many good documentaries and there's so little time because we're so busy. We hope that this show is meant to jumpstart your interest. Listen tightly to our sponsors. They're what keeps us on the air. Sit tight. We will be right back. Zeolite is a detox spray. We work specifically with a company called Touchstone Essentials. They are an incredible company. We've been working with them now for several years. And zeolite is a mineral that goes through your body like a one-way basket. It will clean out heavy metals such as arsenic and mercury, aluminum, cadmium, and it hooks onto those metals from a one-way perspective. So once it's bound, it goes out through your urine or your stools and doesn't get redeposited in other places. Everybody needs to have a detox product in their life, and this one is so easy to use and it's so safe. You can take it when you're pregnant, you can take it when you're nursing, you can give it to little children, you can even give it to infants, and quite frankly, I give it to my dog. I actually put a little bit of the zeolite in his water because until we all stop living in a toxic world, we all need to get some of those extra toxicities out, the heavy metals, the persistent organic pollutants, the things that are floating through the air, the different things that we come in touch with in our environment. And we are a big fan of zeolite from Touchstone Essentials. We've been a big fan of their products for several years. Go to drtenpenny.com/detox to get your first bottle of zeolite spray for $50 off.
For only when the government bows to the people will America become great again. This is Malcolm Out Loud here. Join me in pushing back against censorship, my fellow Americans. Right at the top of AmericaOutloud.news are the words: many voices, one freedom, united in the First Amendment. Now is our time, my fellow Americans. AmericaOutloud.news, liberty and justice for all.
Well, welcome back, everybody. Today is our conversation is with Bill Ostrom, affectionately known as Dr. O to us and the whole world that know him, about his book, Yes, It's Really a Thing, Chiropractic for All Animals. Let me tell you a little bit more about today's guest, Dr. O. He is a graduate of Iowa State, where Dr. O began his professional journey in veterinary medicine before pursuing advanced certification in animal chiropractic. Dr. O and his wife, Dr. Amy, who has also been on the Tenpenny Files, are co-founders of the Animal Chiropractic Education Sources, called ACEs, an institution dedicated to training human chiropractors and veterinarians worldwide in safe and effective science-based animal chiropractic. Dr. O maintains an active clinical practice adjusting dogs, horses, livestock, and exotic animals. He also consults for competitive animal teams and works with dog units. Dr. O's singular mission is to elevate animal chiropractic as a respected mainstream component in integrative veterinary care. You know, before the break, Dr. O, we were talking about adjusting baby chickens.
Yes.
Are chickens your favorite animal to adjust?
No. I mean, yes, but
Okay.
no, not really. I mean, we do have some chiropractors that love to do chickens, and they're okay. My favorite is professional rodeo bucking bulls.
Oh, wow.
You know, they're we're talking about a high level athlete that can really, you know, that remember we were talking about those thoughts, trauma, toxins, right? So the reason that those bucking bulls buck is because it's their job. I mean, and they get amped up just like people do. There's all kinds of videos out there. There's a 13-year-old girl that owns some of the best bulls in the country, and she'll walk out in the pasture and pet them. They let her climb on her back and everything out in the pasture, and then they go to the rodeo, and they're like knocking these world level cowboys off in 5 and 6 seconds, and we make a huge difference, and they get injured. The bulls do. Thoughts, trauma, toxins. You have a gentleman that goes off the side and dangles there for a while. What's that going to do to your spine? You know.
Well, you know, I really understand because I've seen it with my own dog, with Tegan, you know, the animal chiropractic, and you've walked me through how to adjust his shoulders. And it's so, you know, small dog adjusting and even smaller animals like goats and things like that make sense. How in the world do you adjust a large bucking bull and dairy cows? How do you do that?
One vertebra at a time. Is one of the things you mentioned early on about the quote from the book about specificity. And it's all about specificity. And it's why, a lot of human chiropractors have think they can do. They just adjust animals without any training, and but the angles of the joints are different in a lot of the different species. And so one of the things that we have here at the ranch is we have a museum of animals that have helped us learn, and we have their spines. And, some of them are animals that would have been rendered if we hadn't said, hey, can I take a look at their spine? The owners are like, well, yeah, I don't know what you want to do with their spine, but yes, you can have it. And so we do have 36 different species of animals in our bone room, and we look at them. And one of the amazing things for me is that we have 6 different deer atlases. Like there's an axis deer, there's a white-tailed deer, there's a mule deer, there's a black buck. And they all have slightly different ways that the joints move. And so if you know those correct angles, then the adjustment is very easy. Just like when you manipulate, like I saw you work on Dr. Amy's skull when you were here, and you didn't hardly move at all, but you knew the correct angles, the correct way to suggest that those bones move, and they did. And we've gone other places to try to get the same treatment that you gave Dr. Amy. And when we come out, I will ask, well, how you feel? And Dr. Amy will say, well, she's not, it wasn't Dr. Tenpenny. And what's the difference? Well, the difference is that you know exactly the amount of force to use, the angles that those bones are supposed to move, and you find the ones that aren't moving, and it's not a huge it's just a suggestion of movement.
Yeah, in osteopathy, the cranial manipulation, they call it a fluctuation. But I'm interested, I really want to know, give me an example of mechanically, how do you adjust a pelvis of a cow?
Just have them set up, and you just get the angle in the correct way, and then you just do a little thrust and they move. If you're in the correct angle, things move. If you're in the incorrect angle, nothing moves.
Nothing really happens. Wow.
And so there's 2 sides. So when the pelvis rotates, you have a high side and a low side, just like in a human. Well, in a human, when we lay down on a chiropractor's table, our high side is usually the most likely affected side, because when we go from standing up to laying down, okay, the way gravity affects us changes, but it's the high side. In the quadruped spine, it's most of the time the low side because of gravity and physics and all that. And so when we set up on that low side and get in the correct angle, most of the time the animal will actually help us.
Interesting.
And they'll be like, so if you set up on the wrong side, they're like, no, no, no. And if you set up on the correct side, they're like, oh.
Wow, isn't that interesting? Well, how long, if you are a chiropractor, a human chiropractor, or a veterinarian, just listening to this show, and I'm sure that a lot of people are going to run out and try to convince their chiropractor or their animal or their veterinarian to take your courses to learn how to do this. How long does it take to become an animal chiropractor?
Well, the most important thing is, first off, you have to be a licensed veterinarian or chiropractor in the United States to become a certified animal chiropractor. Because we have we have high school people call, you know, young people in their undergraduate programs and whatever, and they're like, I want to be an animal chiropractor. Well, okay, let's go to chiropractic school. Let's go to vet school. We, of course, recommend chiropractic school, even though we're both veterinarians. The reason is because of the success paradigms that both professions live with. Veterinary medicine has one of the highest suicide rates in the U.S. for professionals. Most veterinary clinics are open a minimum of 60 hours a week, and usually most of the veterinarians work over 40 hours a week. Corporate medicine has its good things and its bad things. One of the things is they are getting closer to a nice work week, but they're not necessarily treating veterinarians very well. But I don't know a chiropractor's office that's open, more than, 40 hours a week.
So how long does your training program last? How many years do people have to go through that?
Well, it's 240 hours and it's self-paced. So
Okay.
like they could sign up today and be done in 3 months.
Oh, wow.
But we do have people that sign up today and will be done in 2 years. But it's entirely up to them. Where there's 5 different schools in the country where veterinarians and chiropractors can go. Just like I know one of our previous conversations was that you looked really hard to know which osteopathy school you wanted to go to. Okay. Because you went to one where they actually still taught manipulation. You still learned how to manipulate and you did it. So the other 4 programs are a one and done deal. You have to go boom, 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 go in the right order. And they do not let you adjust in class because they have larger class sizes. It's too hard. Our program is very small. Our biggest class size is 20. And we always make sure that every student here, every weekend they come, they adjust. They don't watch us adjust, but they actually adjust 5 animals.
Are there any animals that should not be adjusted?
I'm glad you asked. Yes. So, number one is we do see every once in a while a animal that has metabolic bone disease, and some of these animals get their calcium levels are so low they break their own bones. Usually, those are in exotic animals because we're not getting their dietary requirements correct. And so lizards, some of those things.
Lizards, you can adjust lizards?
Oh yeah.
Oh my goodness. Wow.
Yeah, monitor lizards are a pretty big thing that people adjust. Anyway, but we always do some neurological tests before we do those. And then my other thing is that, so I'm mainly adjusting the atlas. We're not going to adjust a broken bone, of course, but we might adjust above and below. And so when people ask me, when should I adjust? My biggest contraindication for adjusting an animal is if I'm having a really bad day. If my cortisol levels are really high, I should probably not adjust Tegan.
Interesting.
I should get myself right before I adjust. Okay. Now, as long as the animal has a spine, it's really hard to adjust an octopus because they don't have a spine. But as long as the animal has a spine, as long as the animal is breathing, it deserves an adjustment.
I was in Florida in the first part of December, and Tegan had this thing that he has an issue with his neck, that every
Right.
once in a while he just freezes and he won't move his head, he won't look up and down or whatever. So I found an animal chiropractor in Sarasota that actually had taken classes with you and Dr. Amy, and I mentioned that. And It was really an interesting thing to see, and he did a great job. And as I was leaving, there was a little dog, a little chubby, tiny, like a miniature dachshund or something, maybe as a miniature chihuahua. She was really chubby and running around and jumping up and down, and her name was Bubbles, which just
Uh-huh.
fit appropriately. And the doctor had told me when she first started coming there, she hadn't walked in 3 months. And she
Wow.
was just like on fire with all these different things. So, animal chiropractic is so important. How do people find an animal chiropractor for their pet?
Well, one of the things is we do have a animal at acesalumni.com. We have a map, and so you can find and at one of our graduates. And then there's American Veterinary Chiropractic Association, who is the certifying agency. You would be able to go there and find a chiropractor near you. And then the other thing is just, if you Google animal chiropractors near me, you can find one. Make sure they do have the credentials. You know, there's a lot of lay people that are doing animal chiropractic, and some of them get pretty good results for most of the time, but they do not have any licensing. They do not have, most of them don't have any insurance if something would go wrong. Not that it does very often, but there's no recourse as a consumer. You want to get somebody that is at least licensed, so that make sure they're doing. In fact, we just had the veterinary board here doing their routine inspection of our clinic last week, because we're licensed veterinarians. And so they walked through and made sure we had all our dots, I's dotted and our T's crossed. So I want to leave you with a story. I don't know how much time we have left, but we have a deer farming is a thing here in Texas. And the deer belong to the state. And so deer farmers sell the experience of going on a hunt. And we had one of our friends called us up and said, "Hey, we've got a deer. He's been down for a couple of days. Can you come look at it?" So we went out, and the deer had a broken neck.
Mm.
And we said, "Well, you could go ahead and still harvest the meat." And they were like, "Well, not really. We gave him penicillin and steroids and all this stuff in order to try to get him up." And I said, "Well, next time call us first." So about a year later, they did. They said, "Hey, I had another deer run into a fence. Can you come look?" I said, "Yeah, I can come look." So we go out and we get in that little 4x4 that they use to drive around their ranch, and we drive out, and this deer is laying by the fence, and there are 4 buzzards on it.
Mm.
And I'm like, well, I'm thinking, this isn't good. So as we walk up, the buzzards, of course, fly away, and the deer kind of goes, eh. So he's still there. He's still with us. So I examined him, and he did not have a broken neck. I adjusted his atlas. We put him on the 4x4 and drove the 10 minutes back to where they were going to let him go again in the pens. And so got him down, adjusted his atlas again. And he was kind of sitting up, looking around. And I went to check him a third time. And he stood up and walked into the woods. And I was like, okay. And knew his tag number. And anyway, called him about a month later and said, "Hey, we probably need to recheck that deer." And they said, "Well, we don't have any way to catch him. And we really haven't seen him. So I guess he's doing okay." So 2.5 years later, they sent me a picture of a hunter that harvested my deer. Now, people are like, "Oh, that's not good." But what's the purpose? We have a purpose in food producing animals' purpose is to provide food. And so they do. And whether that deer provided food for a hunter and his family, or for a bunch of coyotes or 4 buzzards, you know, which is better for our environment and which is what we need to do. And BJ and Dee Dee both said, Palmer, the originators of human chiropractic, both said that if we could get all the atlases adjusted, we would clear the prisons and the sanitariums.
Wow.
Would be a lot healthier. And
Well,
our goal here is to make sure that all of our food, and by all of our food, I don't just mean here at the ranch, I mean all of our food comes from chiropractically adjusted animals.
well, Bill, we've got about a minute and a half left. So, in a really quick summary here, where can people find out more about ACEs and take your courses, and where would you recommend that they go? Because this is
Well,
really important stuff.
yeschiro.com, yeschiro.com. We'll get you an appointment on the phone with us, whatever. Otherwise it's animal chiropractic education source.com. And we would be love to have you. And just mention the Dr. Tenpenny show, and I think we can get you a coupon for 25 to 30% off. So
Wow, that's amazing. Well, thank you so much. I wasn't expecting that. So, audience, and that is quite a gift. And yes, they do phone consults because, I've had lots of consults with Dr. Amy about Tegan, about his food and about this and that and the other thing. Because I tell you, I'm guilty of being the worst hover mom like ever. And she's told me, you're not the worst, believe me. So, so that makes me feel good. Well, Dr. O, it's been a pleasure to have this conversation with you this morning about, yes, it's really a thing. Animal chiropractic. It's really an important book. It's really well written. It just draws you in, and you just have so many anecdotal stories and talks about things that you just really want to run out and get your dog adjusted to make, or your cat or your animal adjusted to make sure that they're in the best shape and live the longest, healthiest life ever. So with that, I want to thank everybody who's joining us here today and is listening to us in the future. And with that, I want to close out with one of my favorite verses from the Bible. I close every one of my podcasts with, whether it's live or pre-recorded, which is Romans 12:12. Rejoice in hope, be patient in trouble, and be persistent in prayer. Lean into God every day. He will not let you down. We'll see you here tomorrow or the next time, right here on the Tenpenny Files on AmericaOutloud.news and iHeartRadio. We'll have a great day, everybody. Goodbye and God bless.